thank you all for joining us. I appreciate your taking the time to do this. I'm Chris Teal, and this year's GSAR president, and welcome to the fourth Raising the Bar. Our sponsor for today's Raising the Bar is Salve Bank, and John Petras has joined us from Salve Bank to share a few words. I believe, John, you're here?
Yes. Thank you, Chris. I appreciate it. I'm the residential lending manager at Salve, for those that don't know me. Salve is a proud sponsor of the GSAR, and we couldn't do our business without all of your support as well. And just a little bit of background on Salve. We are in our 103rd year in business in Onondaga County, and we are the oldest independent commercial bank headquartered in Onondaga County, something we're very proud of. It's an interesting year. We are having a strong year in the residential business, something that we're very thankful for. And in many ways, it's due to your referrals coming to us. So again, thank you very much. A couple things that we've done this year, and what have we done differently in terms of the pandemic? Virtually everything. Much of what we do is virtual, although if a client wanted to meet with us, they can certainly schedule an appointment and we go through the proper protocol. We've taken our rate locks, we've extended those out 30 days at the original rate lock price. We're not charging anything additional for it, yet we're still closing purchase business in 40 to 45 days. We can do that much quicker if necessary, but at a normal pace, it's about 40 to 45 days. On our construction loans, which we had initially an 8-month lock, we are virtually at an industry-leading 9-month lock on construction loans due to delays that the builders had with materials and things of that nature. And in some instances, we'll actually go out to a 1-year lock on construction, again, at no additional cost to the borrowers. As I had said, virtually everything we do is virtual at this point. We encourage clients not to meet with us, but if they desire, we'll certainly accommodate. In terms of our loan officers, all of our loan officers have minimally 15 years of experience, and many have over 30. Why is that important? As you know, the competitive nature of what you're encountering in the marketplace, you certainly don't want to have faulty pre-qualifications. And I can say I haven't seen or heard of a faulty pre-qualification coming out of my department in years, something, again, we're very proud of. That being said, thank you once again. Have a great remainder of the year. And by all means, please stay safe. Thanks again, Chris, and thanks for the time this morning.
Absolutely, John. Thank you for sponsoring us as always, and we appreciate your joining us as well this morning. So we also have our sponsors, our regular sponsors, and I'm going to begin with our platinum sponsors to recognize them. Platinum sponsors for 2020 are Empower Federal Credit Union, Lang Law Offices, and Salve Bank. Our gold sponsors are AmeriQ Credit Union, Fulton Savings Bank, Hinman Howell and Cattell, M&T Bank, Paragon Home Loans, and Tompkins Trust Company. And our silver sponsor is the New York State Association of Realtors. With that said, I'm very excited to have our guest speaker today. Our guest speaker is Dr. Indu Gupta, who is Commissioner of Health at the Onondaga County Health Department. She completed her medical degree in India, her Master's of Arts in Public Administration and Certificate Advanced Study in Human Service Management and Policy from the Maxwell School at Syracuse University, and a Master's of Public Health from Johns Hopkins University in Baltimore. Prior to her current role, Dr. Gupta was an assistant clinical professor at the University of California at Los Angeles. As the Commissioner of Health, she dedicates all of her efforts to identify the health priorities in the community through a robust community health assessment process and works towards implementing the Community Health Improvement Plan with strong community engagement. Dr. Gupta will share public health practices for safely working with consumers, as well as tips for upcoming flu season, and how to identify and cope with mental health issues. This has certainly been, I'm sure, just a staggering 4 months for Dr. Gupta. So for her to have taken her time to join us today, I'm ever thankful. Dr. Gupta, with that, I turn it over to you, and thank you for joining us. Ma'am, you're on mute.
Thank you, Mr. Teal, and all the attendants and who are representative of your organization. These are trying times for all of us, but that's where all our characters come out, right? In a difficult times, that's where our strength comes, and that's what we show to each other, that we can support each other and go through this process. And especially, this is a pandemic after 1918 that has been such a significant importance at this point. Instead of having like a big presentation, I thought I'll just give you sort of things in last almost 6 months now, actually, since we had our first case announced on March 16th, 2020, when we had our first case in Onondaga County. We had prepped quite a bit throughout for several weeks before. The first time when we heard something was happening in China in December, I myself was talking to our medical director, because the boundaries don't exist anymore in this global world. We can be in 24 hours in China or Africa and then be here. So it doesn't matter of time if any infectious disease emerges, whether it was SARS in the past or MERS in the past. These has happened in the past, 2008, 2012, and also and Ebola and Zika. You have heard of all those things. So when we think of all these things, that how the disease can come to our doorstep, we really have to think ahead. So we as a local health department, we worked tirelessly in terms of what we call public health preparedness, trying to handle if things do happen, how are we going to handle it at our local level. And we do so by working with our state partners along with the federal partners with the CDC. So regular exercises and all those things, which have been very, very useful for us during this pandemic response. Fast forward, we saw that and the cases started to appear in Washington and in West Coast primarily, and then it happened in our community also. Moving fast forward, it just something will be important that how many cases we have. I'm not sure how many of you keep track of that, what happens in our community in terms of cases. Is there, I hope you all are looking at our local numbers. If you live in this county, or if you live in neighboring county, because Central New York actually, is Oneida and Oswego and Madison and Cayuga and so on. So we have the whole Central New York area where local health departments put a lot of data in their website, and I would encourage you to all look at those numbers. At the same time, there are a lot of resources. So as I'm looking, I don't know if I can share my screen. I can show you how that works. So after this, at least I am hoping that everyone will keep monitoring what happens at the local community. Would you like me to share the screen?
Yes, please.
Okay, so let me see if I can. So you will have to allow that. So it says host disabled.
Okay.
So I don't know who has, if I can be. So I just would like to at least go over to see that how many cases we have, how do we do case investigation, and what is the role, and then also, especially when the flu season is coming, it's really important to think you have two communicable diseases, two infectious diseases are knocking at our doors, and then how we as individuals can take steps to actually to control that, at least, say no, you kind of stop out there kind of thing. So if I may, I don't know, not yet. Okay, participant. Okay, let's see. Okay, I'll wait. So I can, am I getting permission?
Yeah, one of our admins behind the scene will try to turn that on for you.
Okay.
Christine? Go ahead, Christine.
Katie's got to do it.
Okay, thank you.
Okay, hold on a second. Let me
Okay.
see here.
So in the meantime, I think a lot of it is almost 3,800 cases since the first case in March. We have that many cases diagnosed in city of Syracuse, as well as in all the towns and the villages. We do kind of on a daily reporting, which we do. how many people have recovered. We unfortunately have lost a little bit over 200 people in our community, and then a lot of people have recovered. So there are good side of it, there are somber side of that. Our whole entire community have really came together to address this pandemic. At the county level, my boss, County Executive Ryan McMahon, has been very forefront of it. At least for the last several months, we have been meeting on a daily basis and then talk and regularly and come up with based on the data, come up with the strategy how we can protect, whether it's a testing or whether it's providing wraparound services to those community members who may not have enough support in the community, because there are so many repercussions of this COVID that we don't think of that. If as a clinician, as a clinical provider, if I took care of you as my patients, then you come to me, I will take care of you. If you need to be hospitalized, I will hospitalize you. And then after that, I will discharge you. And at the same time, if you cannot afford the medications, if you cannot get the prescription, if you don't have transportation, if you don't have food, so those are the things which are very important part of our conversation when we try to take care of an individual. John Doe, think of that, 60 years of age, unemployed, homeless, and also have COVID. How do we handle that? A young mother who doesn't have much support has COVID. How does she cope up with that, right? You have a childcare issues when the school was closed. So a lot of those things have gone in the background that a lot of times to making sure those who were diagnosed with COVID can continue to recover and stay isolated. And those who were their contacts, that means those people who may have been exposed by this individual, John Doe, or this young woman, will be in quarantine. And that's the principle of controlling the virus in our community. So can you see my screen?
Yes.
Okay, so this is our Onondaga County Health Department's webpage. And there's a top, I mean, you don't have to go further. So it says, you can see, I'm going to click on it. It says COVID-19. So it takes you to the different page. And it has multiple areas. So you have a lot of menu up here. Home page has any new directives, any travel advisory, complaints from a business, right? Request to quarantine, release or isolation release, workplace recovery guide, FAQs, which we put in the data and reports. A lot of those things, and you see those blue, right? A lot of those things are active links. So it is literally at your fingertips when you are going to this website. We took a lot of information from CDC, from New York State Department of Health, and put it and gave us a local flavor. So you don't have to go far and go to 5 different places and kind of try to get information. So if you go, everything is here, and that's a home page. Then if you go to the news, it takes you in a different way. It just gives you what is happening. If there's a press briefing, there are press releases when we do, it happened in the churches and the pubs and colleges or different places. So local data, that's another one that is very important especially for the kind of work you do, is that the community transmission in locality. As such, the towns and villages are separated by little borders, I suppose. But in this mobile world, we don't walk a lot of times. So we take our cars and we go 15 to 30 to 50 miles in one day for work or something even more. So it is important to learn about what is happening in terms of cases in the community. So here for our community, Onondaga County, we have put in the data page all the information. It's a dashboard, there are key indicators, and who is becoming impacted by that. They are in a very, very simple format. I'm not trying to make you a public health expert. I'm not trying to make you an epidemiologist or a doctor or a nurse. I think I want you to be an active, engaged community member who are actually taking care of people's need in terms of housing and, selling houses and getting people to see places and all those. So you want to be safe, At the same time, you want your consumers, your clients to be safe, because they go to their home, they bring things to you, and you come from home, so you can take it things from them, and vice versa. So if we have that responsibility towards each other, we can be very respectful of each other, at the same time be a very productive part of the community, right? I hope that makes sense. So information about what is happening is important. You can turn on the news. A lot of times it's very hard to figure it out, what is real, what is not real. This is real data, comes from people's labs, comes from real people, right? Without identifying the information. So I'm going to just give you a one. If I go through the page, it tells you how many people are hospitalized. It tells you by race distribution. It also tells you our demographics. So for example, what is the difference between different demographics? If you take a race, ethnicity, age, hospitalization, deaths. So everything is literally at your fingertips as I'm moving this fast. Not to bore you, I hope in your little bedtime, I think you may want to just flip through the pages. I think it would be important, and have a conversation with your family members or your friends, and make it like a little, FaceTime talk or someone. So if you go into the dashboard, I think I just wanted to go over that. You might have seen the Johns Hopkins, my alma mater's, all popular, famous, the world famous now. And you have so many millions of cases throughout the world. And then you have US cases. So this is ours here by the municipality. So this is Onondaga County. I clicked onto that icon. If you look into that, it gives you confirmed cases 3,800, right? So this gives you a map here. And the color coded is that which one has high numbers, which one has low numbers, sort of thing. And here you have different numbers. Without going into too many things, almost a little bit over 3,800 confirmed cases. However, almost 3,500 has recovered, right? It's a good news. 173 people are active right now. It means we are monitoring them. And then unfortunately, 205 people, we know that they have passed away from this COVID because these are the deaths which has been happened in the hospital or happened in nursing homes. So that's a combined data. If the people passed away at home and they were not reported as, that we don't know. But in general, this is a very good data for all of you. If you want to go to Syracuse, if you live in city of Syracuse, there is a separate dashboard also there. So I think it's important. The other thing which you want to look into is testing, right? So testing is an important part of that. We are working through the opening of the school. And then, as you might have heard, if you follow some of the local news, is that they have been staff testing as the county's initiative. So school district and teachers and staff testing, and they can pretty much schedule their times, right? So a lot of those things are there. And there are we had some mobile testing. That's where we put a lot of information if they're available. But a lot of times we ask people to go for their own physician if they can do that, or there are drive-thrus which are available. Community Health Center does it and Upstate does it. But a lot of times is depending on if we are recommending them, depending on if we have concern that you may have been exposed to a case, then we would recommend that. And then that actually will be covered by the insurance as far as we know that. For the screening, it's kind of a little bit trick. The other thing is release forms. So if people are in isolation and quarantine, they need official order. So commissioner's order, that means I have the authority to put people in isolation and quarantine, and that's what people have been getting. And then also at the same time, the release happens. So what is isolation, right? Isolation is when people are diagnosed with the COVID-19 by lab. It has to be lab confirmed. And usually, in general, most of the time, it's a 10 days of isolation. It means that person really needs to stay away from everybody. So people can live in their own home. They have been recovering. They have done great. As you can see, so many people have recovered. And those people who do not have, like I talked about, homeless, or people have very one-bedroom apartment, multiple family members are sharing, then we actually provide that support if they don't have that. That's the responsibility of the county because it's for public good, and that's the role which we play. And we provide food and all the kind of support which we do. And the quarantine is what the means is, so if there are children in the family will be considered, or the husband or wife or significant other, all those will be considered exposed individual, and they will be in quarantine. So quarantine is a word which is used for either household contacts, those who are loved one near you, or the friends and families or coworkers, depending on how close you were, whether you were wearing mask or not mask. In the house, it's very difficult because most of the people end up becoming contacts. But at workplaces, if you have a well-defined work structure, it's like creating a safe environment for people to come to work, and more than 6 feet distance, and people are wearing masks, and not trying to having those breakout lunchrooms and all those things, and staying in their own kind of known pods and sort of creating their own hub, that actually protects you significantly a lot. So depending on how outside people, we consider them also contacts, and we put them in 14 days of quarantine. It means you cannot leave your house for anything other than if you're an essential worker. An essential worker is defined by what your employer thinks. You could be a nurse, but still your employer might say that, nope, you're not needed, you can stay home. You could be a doctor, you can still be. So depending on what is the need of that organization, I think is considered. So this is not a blank check to everyone. It is decided by the boss at the top that you are going to come back, and then that's allowable. That person comes to the work and then goes back home, no shopping, no nothing. So that's pretty much kind of door to door. And these are important. Again, why? Because for those 14 days, if you do end up getting symptoms, you are not going to actually create problems for anybody else, and then be contained. So one person's case stayed one person case, instead of having, as you have seen some of those things that the parties, the young kids are doing nowadays. When I say young, means you're talking 15 to 50 at times, even younger. I mean, most of the time, most of the cases, our highest number are between 29 to 30. And then if you add 15 to 19 years of age, so 15 to 30 has the largest bounce of the cases. But unfortunately, the consequences, who pays for it, because of the continued exposure and having transmission of virus, are the older folks who are living at home, who are coming to your get-together. And if you are just hugging your grandma and all those things, and all these things, they pay the price, unfortunately. They end up hospitalized, and that's what, that's all pretty much, if you look at our data, you will see it's happening in our local community. It's not coming from CDC, it's not coming from New York State Department of Health, it's our own community. That's a real data. So the other thing is to look is the reporting guidance, if you can, and there are for the businesses. And then we have promoted quite a bit the OSHA guidance. If you look into, with the reopening guidance, it is New York State forward thing is there. There are different phases it's putting. You all are familiar with it. I'm just trying to kind of putting consolidated place for you. And then we also even created a consolidated sort of a 15 pages, I think, based on OSHA's, that how a organization can protect their employees, as well as to their clients. Basically, all these protecting your staff, protecting your clients, and then creating the safe environment. The few principles you want to, it's not a no-brainer. You have heard all of it. 6 feet or more away, masks all the time. I mean, so I have been coming here every single day. Now for last few weeks, I think few months, we have started to kind of weekends, if I don't need to, I still work 24/7, but physically. So mask is the best one. I had cloth mask, I have surgical mask. I bought it from, I think, one of the stores. Not the N95. It's important to use. Not to use that. There's no reason to. Even I, as a health professional, even I'm not doing direct care, I'm not going to waste N95. As face shield alone is not enough. You got to have this if you're if you want to protect yourself, especially when you're flying. That's important to have the shield and then face mask. That keeps you good, especially some of the flights are very full. So the point is that when you are, from your point of view, the kind of work which you do, as I understand, and correct me if I'm wrong, is if you are showing the house, if you are inviting the clients to see that place, or you're going to the office, make sure your workplace has all these safety guidance in terms of health screening. I think it's important that if you are sick, do not go to work. Talk to your boss, or your boss, if he or she is sick. They shouldn't. We are all human. We are all, can get infection. Virus does not see age, sex, sexual orientation, race, ethnicity, how rich you are, how poor you are, where you live. It just finds a human body, or actually I would say a live body for mammalian body. A lot of times, which you saw that, bats and camels and all those have been impacted by these viruses. So it is important to keep that in mind, that it does not discriminate. It just will get you as it finds opportunity. It will jump from one person to another one, unless you create a barrier. And barriers are the one which you are creating by masks, by washing hands, because if anything got stuck to your hand, that is important. Your sanitizers are your best friend in your purse. Don't leave in your car, because they have been sometimes flammable. So small, simple things can make a difference for all of us, right? And staying home if you're sick. Temperature checks, we actually instituted in ours since we have been coming here. I have a lot of nurses and case investigators. We do huddles in a way that with the physical distancing. We started to using a lot of virtual Zoom meetings and for our staff also, just to protect everybody, because we have no idea that we follow the same principle as I am telling you. So it will not be good. I have to practice the same thing as I'm preaching here. So a lot of those things all of you can do if you are doing a showing. I think it's important, without any hesitation. You should ask the client that, about, I know you're trying to be respectful. It's a protected health information, but you are not actually breaking any laws. You're not making people uncomfortable. Start with yourself and say, listen, in this COVID time, I feel that I should disclose that I am feeling fine. I have checked my temperature. I'm good. I have nobody in my household who is a case or a contact. And I hope I am expecting you have the same thing if you let me know. That kind of breaks the ice, and suddenly, the other person does not feel comfortable. Because unfortunately, sometimes people don't think when they're emotionally charged, there's a nice house and I want to get it and it's going to go away. All those kind of things come into the picture. I have been there. So I know firsthand. That's something you don't want somebody to get it if that seems like your dream place. And you want to see it and get the deal done. So a lot of those things, I think it's important, because you can protect yourself and you can protect them also, because it's being respectful for all. And for other thing is in this page is the resources. It's something, and there are FAQs which we put it. There are a lot of FAQs. And even in reopening guides, if you look at the drop-down menu, there are colleges, if you have kids in the college, schools and gyms and recreation. To make the long story short, I did quite a bit long talk actually, is that there's a lot of information at literally your fingertips. So I'm going to stop sharing, and with that, I think which I would like to kind of go over a little bit to one thing which Mr. Teal has mentioned, that COVID and flu. So yes, flu season is here. We are in a beginning of trying to do flu vaccination campaign. And I think it's very important. One of those things you as partner, you can have in every place, you can put, we are actually trying to, before I came to this meeting, I was reading some of those things, is that we were trying to do promotion for the flu reminders, that this is not the year people say, oh, I'm not going to get the flu vaccine. I do fine. I don't care. Yeah, you should care, because you don't want to get confused that you have this or this. Is that guaranteed that flu vaccine is going to protect you 100%? No, I will be the first one. But at the same time, it reduces your chance of getting a bad flu, and also in a lot of cases, it actually will prevent it. Along with your mask, along with your physical distancing and all the principles, staying home when you're sick, it is going to do that, because when we started to apply that in March, April, before the community was in sort of a lockdown, our flu numbers pretty much zoomed down to 0 2 months before. And, it was such a pleasant surprise in the middle of crisis. And we are hoping it will be the same and people will take initiative. So protecting your health until we have COVID vaccine, and that won't be actually a free ride also, because we'll have to go through a season or two. We have no idea how long the immunity would last, and how many people will take it. What we have in our hand is literally those things, which I'm not going to repeat. I said it many times, in the principles in the COVID, public health principles. The same thing is applicable for flu. And if I can, all of you who are attending, if you can commit to yourself and to me that we are all going to get the flu vaccine, and our family members, make sure, and you're going to disseminate that information in your own or each organization, we will have a lot of people. We are in a process of doing a flu, like a hashtag flu not for me campaign, in which we will ask people to, post your pictures and say that, I got my flu shot. Did you get your flu shot? We have done it. So please look out for that. And we should promote that, because you don't want to get sick with flu. And then on top of it, COVID can coexist with that. Any predisposition of your underlying medical problem, if you get hit with 2, that's a recipe for disaster. So these are the 2 things. I think there was something else you have mentioned. I need to look at my notes. The third thing was mental health issue and stress and depression. Yes, it has been very difficult time for people for multiple things, because you're confined to your house, you're not able to see your friends, you're not able to do your social gatherings. It has taken significant toll. We have seen rise in depression. We as at least as commissioner, as my staff, I have to watch out for their emotional health, providing emotional support at your own organization to your team, and talking about that it's important for your family member, your kids. Talk to your primary care provider. Make sure that you do not hesitate in reaching out. It does not make anybody weak to say that, I'm not feeling good, and I'm just feeling sad, and I am feeling lonely, I'm feeling isolated. It's okay, reach out. It takes a lot of, I believe that if you say that, it takes a lot of courage. That person is very strong to come forward to say that. It takes a very strong person to admit that. Contrary to the feeling that I'm weak, I'm a wimp, and I'm not going to say that. And also there will be so many people who will be really willing to help, not only in your physical and social circle, but at the same time in your medical community, your medical providers. New York State has, may I just interrupt? So I am looking at somebody is waiting in the waiting room. I'm not sure it says admit. There's a chat, it's in front of me. It says Bob has entered the waiting room for this meeting. So the other one thing is New York State Department of Health. If you would like, we are, I'm just trying to think. There is a weekly email blast, which I have been sending regularly from the health department, which gives you a very short summary of what is the case, where we are, and if there is a new information. So if you want to get that, Mr. Teal, I think my assistant can put the emails in that roster. We do blind copy to people, so we just want people to get some. It's a very short, succinct, and it has active links. That will be something you can consider.
That would be,
So,
that would be great. We'll have our folks reach out to your assistant. I know that
right.
they're in
And
touch
then,
already.
so one of those things is, and when you are talking, whoever reaches out to her is one, I think in the first one or second one, we have sent few of them. So there is a one, New York State Department of Health done a really great job in providing a opportunity for people to participate in mental health outreach by a app. You might have heard Headspace, headspace.com. I actually did use that because my some friends of mine have said it before pandemic, and they say, oh, that's a great app. Did you try that? I said, that's a nice one. Let me see. Because they do, that's for meditation purposes. I was trying to do, I do yoga, I do meditation. I mean, I have to take care of myself. Otherwise it just goes all over the place. You know, your physical and mental health is so important. Not only for your own personal family, your daily lives, but who you are overseeing the organization, your work, it impacts your work. So Headspace has been offered to the New York State residents, I think free. It's a subscription service. I actually subscribed for a few years ago. Then I let it lapse. I said, oh, I can do that, but it motivates you when you do. So you actually should look into the state might have that in the website. Otherwise we can look, and Kathy Clark can look at and then can send you that link. It is really important because it's your own control. It's just taking time for yourself, 5 minutes, 10 minutes. You don't have to be a guru in those things, right? I just do it because I just want to take care of myself. I want to respect myself. It's my own time. And if I take my own time, I can take care of others. A long time ago, my mother, who passed away, my parents were a great influence in my life in terms of education and also taking care of yourself and respecting yourself. So she said it, if you don't respect yourself and take care of yourself, why would others trust you, right? So it's important to think about that. I have to start from myself, and that is something we need to all do. So that includes, you know, flu shots and physical, mental health and exercise, walking the dog or playing with your kids, and whichever way, playing the music, whichever way. There's no one right answer for that. Whatever makes you happy gives you that jolt that I feel, wow, I feel happy about that. You know, it's just something, just putting a Star Trek, you know, becoming Spock, you know, those kind of things, my favorite person. So the point is, whatever your niche is, makes you happy, that's what you need to find, especially in this time. It will pass, it will go through. I'm very optimistic. People have more power than they think. I want to remind them that they really need to not feel helpless. Frustration is part of life, right? The day we are born, we cry, the baby cries. And the only day we be quiet when we pass away, right? So we are going to be frustrated, that's okay. But we are human is the most advanced creature in the universe. That's what we know of, not that we know any aliens exist. But we have a power to make things better. So we should be doing problem solving and make sure that we are there to go through it together, not alone. We cannot do it alone. We do it together as the community, as the society. So with that, I will open up for the question if you have any.
Sure, we do. And that was very well phrased. Thank you so much. The first question I'm seeing is a question about the incubation period. So it reads as follows. If you're tested the day after you are exposed and get the test that day, will the test catch it quickly, since the incubation period is 5 to 11 days is set here? So I guess, what is the incubation period? What's
Right.
the best protocol for someone that believes that they were exposed?
Right. So great question. I think we do get it. And we did all these things. Actually, we did put in an FAQ. So incubation period is 2 to 14 days. So it could the minimum of the 2 and maximum of the 14. On an average, 5 to 7 days. That's what we see. So if you get the test second day or third day, it's too early. You are negative that day, doesn't mean anything. So if you are exposed and if you put in quarantine, we're not going to let you go. And we actually don't let you go even you get tested at the 7th day. So 7th day, you get the peak. 80% people can convert by 7th day. So we recommend people to have it, if you really want to do the test without any symptoms, then do, because of exposure, then 5 to 7 days. Don't do before 5th day or 7th day. 4th day is the kind of like a margin there, border. If you are officially in quarantine, you will still not be released, whether your test is negative on 8th day or 7th day, because you can still turn positive later on. So that's why the whole range is maximum number of people do convert in those time frame. But we have seen that people at the tail end of they become positive, and that's the public health processes, that we don't want those people to socialize. It just gives you comfort at that time, especially if you have, just feel like, I really want to know, did I convert? If you have any symptoms, of course, that should be tested at any time. There is no time limit for that. And if somebody, and the caveat of not caveat, and the complexity of that is somebody got symptoms at, let's say, 9th day, and then got tested, then they will have 10 more days of isolation. So that adds up to that, because it took that much. So I just added one additional kind of answer, I think, if somebody is thinking about that. Hopefully that answered the question.
Yes. Also, how will the flu season change being careful about symptoms? How can you tell the difference?
Not really, you can't, because the symptoms are almost the same. You have fever, you have cough, you have body ache, you have running nose, and you're not feeling good, you're tired. All these things are diarrhea, nausea, all these things do exist in flu. These are viral illnesses, and most of the viral illnesses are pretty much about the same. So there is no differentiation at that, other than the flu test is being done. There are other common cold viruses do exist. So a rapid flu test in doctor's office can give you a flu test, but it does not cover other common cold viruses, which are also some other coronaviruses, not the COVID. So coronaviruses are multiple. There are many of them. And then COVID-19 is the name of the disease. The name of the virus is SARS-CoV, capital S-A-R, S like a SARS, dash CoV-2. That's what it is. SARS-CoV-1 was for SARS. That's what it is. And that was that was many years ago. So there is, the virus detection is done especially by the test, whether it's a nose swab. People go for their doctors, or they go for the, drive-through or different places. Now there are urgent cares, and different places are doing antigen test. There are some saliva tests are coming up. There are multiple tests are in commercial making at this point. And if they will be, it will be great if we have a home testing. So, we are waiting that people can have a very simple, it's like a pregnancy test. And then, but what are the implications? It's not that knowing that you're positive, what you're doing about that. You have a test positive and you still go and stop shopping at the Wegmans and go to the gym and exercise and don't do that. You're not going to control that. So the personal responsibility is still going to be there for individuals. So the testing is important in the right time. And the virus detection can be done by the test for the flu and SARS-CoV for COVID-19. There's no combined test as of it now, in which you can have the whole series at the same time. And that's what they are working on it. It's not out there. So if you go to doctor's office or go to emergency room for something, they can run the whole gamut of tests at the same time if they are suspicious about that. But it's not there yet. They have to do separate tests.
Are the efficacies of say a rapid test and then a test that takes several days, are they one and the same?
So the PCR test, which is the nose swab, most uncomfortable one, are one of the best ones they detect. They're false negative, what we call that. If you have a disease and you don't show up, is very, very less likely. While in some of the newer tested, depending on if they're doing oral swab, some of them are really good. But at the same time, some of them have not that, they could be what we call sensitive. It means they can detect disease, but at the same time, if people can have symptoms and may have disease, but may not detect it. So it varies from test to test. The FDA gives approval for those, and they do. If you really are interested in that, you should go to FDA's website and look at the test approved for COVID PCR. That's a molecular test, not antibody. Forget about antibody. I'm not going to even promote antibody test. And if you're thinking of that, that's not the best way, because it doesn't tell you anything other than it might say, oh, I was exposed to that, but what does it do? So you're looking for non-antibody test, COVID testing, and then you can read through. It's very simply written actually, and you look at that, what we call emergency use authorization, in short, EUA, EU like EUA authorization, and that gives you kind of specifics about that. If you are interested in how good that test is, and they have authorized it. So that gives you a good idea. Most of it, the antigen test, they are doing some of the urgent care tests. They're okay. They detect them. We take them. I would rather know more false positive rather than false negative, what means that we would want people to be isolated than not isolated. The problem with some of the tests, which we have noted, that the test can be positive for a long time. So if somebody doesn't have any symptoms, we had no idea when that person was positive. So in the symptoms was clearly, if somebody's asymptomatic, doesn't have any symptoms, which at one point we have almost 50% of people were asymptomatic when we did a lot of testing. They have decreased down quite a bit now because we have low number of cases, so they're less also. But that creates a complexity. That test can be positive for several weeks. And there is a very clear definition when we consider somebody have been reinfected in some situation. So.
The next question is, there are a lot of people coughing and sneezing lately. They're assuming it's seasonal allergies. Should they stay home?
So that's, again, it's a very good question. And that's where your conversation with the physician goes. You should call, so seasonal allergies are there. Yes, that's a reality. And depending on how your history is, depending on how much your travel is and how much your exposure is in the community, that where you have gone, if you have multiple get-together, if you have seen some people who are new to you, the chances of that you may have high possibility that you may have been exposed to somebody who you may not know. So getting a test will be appropriate that time. So the best thing is to talk to your physician. That's where the physicians come into the picture. They can do a televisits to you nowadays, like we can do those kind of visits, right? If I was practicing, I would have used that and asked all the questions. And depending on, do I feel comfortable saying that, do you have allergies? I can say, well, you should try Claritin or Zyrtec or some Singulair or some other things, and nose spray, and then see whether they are similar symptoms. And then if you're not better, if you have no other fever or something. So a lot of those things is physicians know their patients. Like if I know some of my patients do have these symptoms every year, and they have been really good with their regimen, would I go and jump the gun? Maybe not, but depending on a level of comfort of the physician, it's a one-on-one conversation with your own doctor. I think I would strongly recommend that. And if they recommend testing, go for it. They will give you the advice that try this for a few days. If it doesn't, we are going to do testing. Go for it. That's how we will know. There's no reason to feel uncomfortable. There shouldn't be any stigma about that. Oh my God, how did I get exposed? I did everything right. Because you can have been exposed for the last 14 days. So when we do investigation, we look for 2 days prior, because that's what you're infectious from the day of test or your onset. But the person could have become symptomatic or become positive in 14 days from before. So those are the things I think people need to be very I don't want to go to aggressive, very forthcoming with their doctor, and then say, this is what happened in last 14 days. This is what, and when our investigators talk to them, if somebody's case or contact, we always say, give us as much as you can, because we can really protect you, your family, and the rest of the community. So having a good conversation with your physician, instead of running to the ER, I would recommend not to just run to the ER or urgent care. You have your own doctor, talk to them. I think it's important, because over testing doesn't help. They will give you the right guidance, and they say if you should be tested, I think it's important.
I'll call your doctor. Very good. What are your thoughts on the after effects for people who have recovered from COVID?
So based on the literature, we don't get the follow-up, after people recover, we don't have any communication with them. But what the literature is saying that even young people have leftover impacts in the lungs and different bodies, and it takes time for them to recover. So it's not like just, even in flu, if you remember, these viruses they push your body to the limit. It means they generate an immune response that shooks it's like earthquake in a way that your body is shaken. And how every system of your body can respond to it, whether it's your heart, whether it's your neurological system, whether it's your muscles and your kidneys and your lungs, all those things, and depends on how healthy you are, how your immune system was able to fight it, and how much you continue to support your body with the food and nutrition and taking care of yourself. So a lot of combination is that not kind of saying, oh, I'm fine, I'm going to get better. Yes, it's a great thing if you are, 15-year-old, if you're 20-year-old or 30 or 50, even 70-year-old. I have seen 90-year-old have done good, and I have seen, a younger one, even in 20s, having hard time. So there is no easy answer to that. Yes, young people do a lot better, healthy people do a lot better, but you have no idea who could be. You could be the person, even though you're relatively very good, healthy, you could be the person who might suffer significant consequences.
I read an article, I'm sorry to interrupt. I read an article this week that stated that 30 to 35% of the Big Ten college athletes that have tested positive are now experiencing a swollen heart. So is this cardio as well as pulmonary issue? Can you address that?
Yep, that will be because, and if you remember, one body part, especially like heart gets impacted or lungs get impacted, consequences is for rest of the body, right? And same thing is for the kidney. In certain acute situations, the kidney gets affected. Young people have had stroke-like symptoms, and they have documented very significant. The person, there are paralysis, right? And having no difference like any person who had underlying problem having stroke. So there are significant consequences if you have one body part, if you cannot oxygenate, if your body cannot purify the dirty blood for the circulation, ultimately it will take toll on it. If your heart cannot pump, you will have backlog in the circulation, and the rest of the body will suffer. Your kidney will get impacted, your lungs will get impacted, your brain will get impacted. So there is, our human body is such a perfect kind of balanced whatever you can think of, whichever belief you have, the science, Darwin's theory, I'm a student of science, or you think of the creation, it is a perfect model in terms of that everything is linked to everything. So if you don't take care of one thing, it's going to have repercussion with the time. It's a matter of time.
The next question is, Celeste is interested in hearing your opinion on the school's hybrid plan. Are these kids going to be exposed and therefore more vulnerable than others?
So that is I think school, I am doing actually a Syracuse.com, some kind of live thing today at 1. So if you're interested, you can join and ask that question if you're a parent. I now have to have another meeting at 11, so I'm looking at the clock also. One thing which I would say that we are working with the school districts. I have had several conversations with superintendents, their medical directors, as well as their nursing staff, that there's a plan in place in terms of there's exposure. I would strongly recommend to look at our reopening in the school section, and you will find a lot of question and answer there. We do have the how exposure happens, what is the process of the investigation. There is a flow chart there. I would encourage you to look at it. And also that, and we can change that as the guidance sometimes change. We do change. So these are things live as of it now, and then we continue to change. And if their investigation happen as a parent, or if you're a teacher, if you're a family member of a teacher or student, how the case investigation, we want your help in getting all the right information, because we can only do the good job. It's like a police investigates, right? If you or the doctor gets the assessment, if we don't get the full history, we can't make the good judgment call and then provide the right guidance for isolation and quarantine. And it's similar to if you came to me as a patient and you gave me a vague history, didn't give me that, oh, you had the chest pain started, an hour ago, and then having crushing pain, and I'm sweating and all. Sorry, I would recommend that making sure that you are very forthcoming. You doesn't mean that you are talking. I'm just encouraging everybody that based on that, we can provide much more safer place for this community to live, because we can do a good, thorough investigation. We can find people, we can put people in isolation and quarantine in a very appropriate way. We have certain circumstances where either people, if you have somebody older folk, they didn't remember, we use their the loved one to give us more information, with their consent, because they were the next of kin, or they were power of attorney, or if they were kids, that the parents has to be more forthcoming. And there is no stigma, there is no uncomfortable feeling. Yes, sometimes we all do stupid things, right? People went to war party and they regret it right now. What happened, happened. We can't undo what happened. What we can do, fix it further so we can protect other people. So that's the communication, goes a long way, that it's okay what happened. Yes, at least don't make that mistake again, be forthcoming. So we, when we investigate the parties of young people, if they don't tell us that how many friends were there, you have some kids who were not identified, and their parents finally called. They say, well, my child was not called, it was in that party somewhere, what is happening with that? So we say, well, we didn't know that. So we kind of, a lot of times, unfortunately, things do happen, and we go back and tell them. So at the end of the day, we want a community where we are supportive of each other and making sure we are protecting not only our family, but the rest of the community, because this is a communal effort. This is a societal effort. And we need as all of your help. And everybody brings their piece of puzzle, piece of solution to that. So you have a power. I would like you to use your power to protect this community and protect your family. So I hope you can do that.
I know that you need to go, but before you do, I want to not only thank you for joining us today, but for all that you are doing for our community through your service and your expertise. There could be no more important job right now at all. And I can't thank you enough. Thank you very much.
Thank you all, and stay safe. Take care. Bye-bye.
Be well. Be well.
You too. Bye.